Good evening. This is Dr. Randy Sanders, and I'm here for a mission trip to Tortuguero, Mexico, working with the Chol people. And I wanted to take this opportunity to give you an idea of some of the things that we look for when we set up a dental clinic on a mission trip. When you first come to the village, obviously you need to be in contact with the village elders and leaders, and that should have been done before you went so that you have a contact person. Then, when you arrive in the village, one of the most important things for a dental mission trip is to obtain a place where you can set up your clinic. Dentists need light, as we all know, and we also need a comfortable space to work in. In some places it's being under a large tree, in other places it's in a building of some sort. When you have a building which is completely open, and this is the building that we are going to be working in, when you have a room which is open on three sides, it doesn't get so hot during the day and allows for breezes, which makes it much more comfortable. Another thing about this building that we really liked is that it does have an opening to the south so that we're able to pick up more light. It also allows access to the villagers so that it's a building that they're familiar with. But the most important thing for us is light and some air to breathe. And so this space we found has been very helpful. The villagers have offered it to us, and once you select a space and it is acceptable to the villagers, then what you need to do is to take a broom and clean it out as best you can so that you start with a nice clean space. Then, as you'll see in a moment, we actually start setting the clinic up. And when a clinic is set up right from the very first, it makes your whole trip a great deal more enjoyable. One of the first things that we do is to ask the local village folks if they can loan a couple of tables to us. You usually need one that's pretty good size, which is your clean table, and then a smaller table, which is the one for all the dirty instruments. Most any place in the world, people are more than happy to help, and they can give you some tables that will work. If you don't have tables, you can take boards, you can take anything and make a flat surface. The key is to bring with you a couple of white shower curtains that you can buy at Walmart for $2 or $3, and you can cover any table and then have a surface that you can scrub on and you can keep clean. The smaller table is for sterilization. The larger table is for all of your instruments to be laid out on. And in between we have a trash bag so that everything coming off of the dirty trays that needs to be disposed of can be thrown in the trash bag and not be transferred to the clean table. It's not always possible, but it is helpful if there's an area where you can spread out all of your additional supplies. In this case, there's an opening window which makes a perfect surface for laying out instruments so that you can keep them within reach without having them be in the way. Behind the dental chair, it's always helpful to have additional things. If there's in this case, it's a trunk that we ship things in. It could be a suitcase, it could be a table, a box, anything that you might have which could be covered with patient napkins in order to make a clean surface. You can have emergency things like Benadryl in case of an allergy, ammonia inhalants in case there's a problem with syncope, plus additional gloves, additional gauze, anything that you think might become necessary during the procedure so that you don't have to get up and go fetch. The shipping box that the chair comes in makes an excellent table on which you can place the trays, and that way both the assistant and the dentist can work from them. Obviously we have headlamps. We also have an additional lamp, flashlight when necessary. Christian Dental Society does sell an excellent headlamp, which you can get by contacting Tina at the home office. Adjacent to the patient's head, preferably on the assistant side, we have a container. It can be any trash can lined with a plastic bag. Many times patients would like to spit, and we throw our gloves and dirty paper in there to help absorb the fluid, and that way the patients have a way to spit without having to get up all the time. one of the nice things when you have a choice is to set your chair up in your whole clinic in a place where there's a lot of light. Here we are on the south end of the room, and the light comes in during the day, which obviously for dentists is very important. You can either place the patient's head towards the south, or you can reverse the direction of the clinic so that the south-facing sun is into the patient's face, which helps our visualization, but it also makes it a little harder for the patients. The other thing about the chairs, as you can see, is that there is a stool for the doctor, which is smaller, and it is lower. The chair for the assistant, on the other hand, is higher and also has a footrest on it. The chair itself, as you've seen before, can be put together in a series of steps, which once it is assembled is very sturdy. The last thing that we put on is a rubber mat, which is not included with the chair, but which can be bought at most craft stores. And it's simply a rubber mat that normally goes under rugs in your entryway, and it keeps the patients from slipping on the plastic. The other thing is that when the patient gets in the chair, it's important to direct where they should sit, which is right in the middle. If they sit on the sides, it is not as sturdy. But you should have the patient sit right in the middle, and then they can turn around, and then they can lay back. And in doing so, the chair is very stable and will support people of 300 pounds weight with no problem at all. The instrument table, as you can see, is arranged with all of the clean instruments, totally separate from the instruments which have been dirtied through use. And what we like to do is to have a plastic tablecloth which covers any table which is available in the community. And then we put paper towels down simply as another barrier. We arrange all of the mirrors, all of the perio elevators, all of the forceps that are going to be used for upper teeth pointing up, all of the forceps to be used for lower teeth pointing down. We have trays which are covered in plastic, sleeves. We have the sleeves to put the trays in. We then have the cotton-tipped applicators and the topical anesthetic, along with the anesthetic, both with and without epinephrine, needles, and obviously the bibs as well, so that when the assistant is looking to set up a tray, they can set up a standard tray from everything which is on this table and then move right to the patient. The smaller table is used for the cleaning of instruments, where all of the instruments are returned. When trays are brought in, they are placed on the table, and the dirty instruments are cleaned off in the first tub, which has detergent in it. Using a denture cleaning brush works quite well. Once all of the blood and debris is off, then the instruments are moved into the second tub, which is clean water, and the instruments are completely cleaned of any detergent and soap. Then the instruments are placed into the pot, and this pot is quite full. Normally we would sterilize when there's about half as many instruments in the pot. Obviously using very heavy gloves so that there's no risk of creating any puncture wounds. The other thing that we have in this area on the floor is a simple 2-liter bottle. Any kind of plastic bottle works well. And we use this as our sharps container, and we keep it on the floor adjacent to the sterilization area. Then at the end of the trip, this bottle can either be disposed of professionally or it can be burned in the community. First of all, I'd like to say how much I appreciate you taking the time to look and see what we've done here in Mexico, in Chiapas, and I hope that this has been informative. The last thing that we set up is where we put all of the backup instruments. You've already seen where we place the instruments, but those things that we may need later. We have the extra anesthetic, batteries, extra gloves. We have our medications. When our patients are finished, we give them the appropriate pain medication, toothbrushes, floss, and toothpaste. The other thing that I'd like for you to notice, which is unusual, is we have a water filtration system. done by Nathan Terrell, who's a missionary in Mexico, where anyone in the world can filter their water and be able to use healthy water. And in having it in the dental clinic, we are certain of having water which will not cause any problems. Lastly, again, I'd just like to thank you for the opportunity to show you some of the ways that Christian dentists are impacting the world for Christ through dentistry. And I would bless you and ask that God would give you peace as you go on your first mission trip. Thank you and amen.